Today is Wednesday the 2nd of December and you are very welcome to this video. And I mention the date because it's really quite a momentous day. The United Kingdom regulatory authorities have approved the first vaccine against COVID-19 for use. This is remarkably quickly. This is 10 months since the get-go. 10 months since we started, since the Pfizer Bio N Tech in this case started prepping this vaccine to being given authorization now. As we speak, 800,000 doses are coming to the UK from Belgium. I think some, mostly from Belgium, maybe a few from Germany. And we'll be vaccinating within a few days. We are ready to go. It's remarkably quick. Now, I know what you're going to say, or some people will say. Most of you won't, but some people will say this. This is too quick. How come the European Union are still debating this, and how come the Americans haven't worked this out yet, but the British are going in gung-ho on this? And I'm going to give convincing argument against that. This has followed all the regulatory stages that any normal new vaccine or medicine would follow. No stages have been skipped. We're not in other countries that could be mentioned that introduced vaccines before phase 3 clinical trials were completed. This is following a completely legitimate, tried and trusted, old, experienced process. And personally, what this means now is I would be more than happy to have this vaccine now if it were available to me. But anyway, that's the bottom line, and we'll be looking at a few other vaccines and things that are going on as well. But let's dive straight into this detail now. So it's the Pfizer Bio N Tech. It's in a lot of popular news outlets. You can read this for yourself. That's the BBC one, for example. So the UK is the first country in the world to approve the Pfizer Bio N Tech vaccine, and by extension, apart from other countries which haven't gone through the full regulatory processes, what it means is the United Kingdom is the first country that's gone through all the normal official regulatory processes. Every stage has been gone through, every box has been ticked, and yet we are still the first country to give regulatory approval. And as I said, I would be more than happy to have it. So it's not the first country to give emergency approval, it's the first that's gone through all the correct stages to give approval, or everything that we normally do. No shortcuts. It's all been very fast-tracked, but not shortcutted. It's been accelerated, but stages haven't been missed. That is the key thing I think we need to grasp on this. So we'll be rolling out next week. Now the UK has already ordered 40 million doses. But because it's 2 doses per person, that's only enough for 20 million people. So we've made a start here. This is based on the pre-orders. 10 million doses should be available soon. 800,000 doses arriving in the next few days. So these are coming now. Now. I was going to actually jump a bit there. I was going to say that they're in transport now, and we know the transport is difficult. It has to be at minus 70 degrees centigrade, but we've recently found out that this vaccine can be kept in the fridge for a few days after it's been taken out of the minus 70 degree storage for transport. So it's not quite as difficult a logistical operation as I anticipated it would be. And that's got pretty big implications, because if it can survive at normal fridge temperatures, that's sort of 2 to 5 degrees centigrade, those kind of temperatures, then that means it can be transported around rural areas really quite readily. It means that district nurses can take it into old folks' homes just in normal ice boxes. That's got really major implications. So we'll need to ship it very cold to particular centres, but then we've got a few days from that centre to it's injected in arms, and that makes the logistics massively easier. And that has only been clarified in the past few days, and a very encouraging clarification that is. So we're getting 800,000 doses in the next few days, 2 shots 21 days apart. It takes a few weeks for immunity to build. Now, there will be a degree of immunity 7 days after the first vaccine, after the first shot. So there'll be one shot will be given, there'll be a degree of immunity 7 days after that, but then another shot will be given, another vaccination will be given 3 weeks after that, 21 days after the first one, and then it's going to take another week for immunity to reach its full extent. So really we're talking about a 4-week process here to immunise someone as a result of this vaccination. So it's not instant, but it's fairly quick. And this is typical with two-dose vaccines. This is nothing remotely unusual for the COVID-19 vaccine. Now, it's manufactured in Belgium and Germany mostly. So as far as I know, the supplies that are coming to the UK are coming from Belgium, which is not far away at all. Transported at -70, but once delivered it can be kept in the fridge for up to 5 days, according to the BBC report. Certainly a few days. And this really does change everything. This is quite a transformational change. So it could arrive in London, for example, at -70 degrees centigrade. And then you can get a train from London, where I live in Carlisle in the north of England, for example, in 3 or 4 hours. You can get to Edinburgh or Glasgow in 4 or 5 hours. And the vaccine will be absolutely fine, just using normal refrigeration facilities, which is no problem at all. We do this all the time. This is normal for vaccine rollout. So this is very, very encouraging for transforming the logistics. Total development time for the vaccine, 10 months. Quite amazing. Stages have not been skipped. Phase 3 trials have been done. 2 months safety data has been recorded. It's all really quite impressive. Now, the accusation is that the UK government have rushed this, and the European Union and the Americans are taking a bit longer, and other governments are taking longer. The British have been gung-ho, going off half-cocked. Is that the case? So let's look at this. So Medicines and Healthcare Products Regulatory Agency, that is the government body concerned who are in charge of this. Now, how come? I don't want to get too, well, I'm not getting political about this, but it's the point is the United Kingdom is in the European Union until the end of 2020, until the end of this year. So we are still bound here in the UK by every European regulation. So how come the UK has authorised it now, but the European Union haven't, when we are still bound completely by European regulation? 1st of January we won't be, up until then we are. It's legal. We are bound by that during this so-called transition period. Well, what it is there's a European Regulation 174 that allows the Medicines and Healthcare Regulatory Authority in the UK to give temporary approval in light of emergencies. Now, as far as I can tell, other European governments don't have this. So I guess we're just fortunate in the UK that this provision is there in European Union law, which we are still bound by. So that's why we can do it now. The Medicines and Healthcare Products Regulatory Agency received this application on the 23rd of November. Therefore, they have made their mind up in 10 days. Now, to be fair, I would imagine that they've been following the research pretty closely on this. So I can't imagine that they'd say, oh, has Pfizer got a vaccine, really? We better start having a look at that then. I imagine the experts that this is delegated out to were well up to speed when the official application was received on the 23rd of November, and they have really hit the ground running. Now, I'm not going to go into all the details of who these people are, but you can look it up here. So that's the government website there, and there's lots of detail you can look at. So who are they? Again, this is from this website here. So these are the members of the board. I'm not going to go through them all, but it's not the likes of me that's on it. These are serious boffins, scientists, and many senior people of repute and experience. So that's the members of the board, for example. If you're interested, do look through them for yourself. The final decision is made by the corporate executive team, which is recorded here. Again, these are just screenshots from their website. So that's all available. So the directors of each of the MHRA divisions, this is, everyone's on here. This is a collective decision by many people. So that is why I am happy that this has gone through all the normal stages. And if this went wrong, the government could fall. This is not gone through on a whim. This has followed the normal procedures, and you can look up all those people if you want. But they're all authorised and all available. And not only that, the meetings, I don't know about all the meetings, but certainly a lot of the meetings, they have a fully public domain. You can book as a member of the public and attend their meetings. This is a transparent process. It's not a random decision. It's following a well, trust and tried process. And I guess we're just fortunate that we've got this Regulation 174 exemption clause that allows us to do things in the UK as an emergency. Now, what's happening elsewhere? The European Union Medicines Agency isn't meeting till the 29th of December. Now, this just beggars credulity. They were given presumably been following this all the way through back since this research started in February, March. If they've been doing the job properly, they've been following this in day-to-day detail, of course. And they got the full formal application on the 23rd of November, the same as we did in the UK, the same as the US. And they're going to get round to having a meeting on the 29th of December. Now, I'm not saying they're not working on it now, but it really is surprising. And it's important to remember that the British regulatory authorities, the American regulatory authorities, the European regulatory authorities, and every country in the world is given exactly the same detail by Pfizer Bio N Tech. Exactly the same information. They all get it on a rolling basis. They get updates. I don't know if it's every day, but it'd be every day, every other day. They get updates. So it's a rolling information process. They know way more about it than we do. We've only got what's on the press release. They've got much more up-to-date information than we have. And yet, 29th of December. Now, this means if the European Medicines Agency deigned to give the go-ahead on the 29th of December, then individual member states, all 27 of them, will have to make individual assessments of this after that. So this means that there is no way, and this surprises me, there is no way that vaccinations are going to be given in the European Union in 2020. Whereas in the UK we're starting in a few days' time, a couple of days' time. So that's where we're at. They're based in Amsterdam. So all the 27 member states have to have a say. And the irony is that this vaccine is made in Belgium and Germany, and the European Union have ordered 300 million doses. And I'm sure we know Pfizer Bio N Tech have got substantial stocks. Their manufacturers have been flat out for some time now. So, but it's not happening. The Moderna vaccine is not going to be reviewed by the European Medicines Agency until the 12th of January. So the Pfizer European shots aren't going to be till 2021. Only then can individual states give authorization for this delay process. Now, what this means is the European vaccination programme is delayed by what? A month? Maybe 6 weeks? That means a lot of lives. That means many billions of euros. But that's where we're at. FDA, Food and Drug Administration in the United States, meeting on the 10th of December. There is no question in my mind at all. They will give the go-ahead for the Pfizer Bio N Tech in the United States on the 10th of December. That means on the 11th of December, people will be getting vaccinated in the United States with the Pfizer Bio N Tech vaccine. That is pretty clear now. Right, what's Boris got to say? It is the protection of vaccines that will ultimately allow us to reclaim our lives and get the economy moving again. And it has to be said, this is going to apply to the UK a month ahead of the European Union. I'm not making any political points about this at all. I'm just trying to report the facts. I am surprised that the European Union has taken so long about this. That's just the information that we have. Matt Hancock, boss of the NHS. People will be contacted by the NHS in turn. I'm confident now with the news today from the spring, Easter and onwards, things are going to be better and we're going to have a summer next year that everyone can enjoy. So Matt Hancock anticipating herd immunity basically by next summer. Now, we haven't got enough of the Pfizer Bio N Tech vaccines for everyone. And indeed, we're only getting a few million or 7 million of the Moderna vaccine. So I wonder if Matt Hancock knows that the Oxford AstraZeneca one is going to be coming online as well. I suspect it will. But we have nothing official on that at all, so I'm not going to speculate further. NHS Chief Executive Sir Simon Stevens. This is going to be the largest scale vaccine rollout in our country's history. Vaccine centres and venues are already being set up now. Conference halls, places like that, all over the place. People are being trained up. And of course, all nurses know how to do this anyway. Now, people talk a lot about GPs in this process, and I'm just trying to remember. I've just done 3 years on A&E up until last year, and I can't remember during that 3-year period a doctor giving an intramuscular injection. I gave hundreds, but the staff nurses and sisters and the nurses give hundreds. Can't remember doctors giving them. So doctors might be supervising this, but if I wanted someone to give me an intramuscular injection, I would go for an experienced nurse every time. As indeed gave me my influenza vaccine a few weeks ago. I literally didn't feel it. Bit achy the next day, but at the time I didn't feel it. I digress. Chris Whitty, we can't let our guard down now. Such an important point here Chris Whitty's making, and of course everyone else would make it. This is wonderful news. It does signal the end of the pandemic. I believe we will eradicate this virus, but not yet. Not yet. This is not going to affect the way that we have to behave over Christmas. In realistic terms, it's simply not going to be enough people to generate any form of herd immunity by Christmas. This is going to be into 2021 and spring and summer 2021 to make a big difference. Everything else has to be adhered to. Masks have to be worn up until then. All of these things have to be done up until then. Buildings need to be ventilated. Vitamin D levels need to be maintained. It's not yet. This is dazzlingly brilliant news for 2021. So who's getting this first? Care home residents and staff, people over 80 first, those most likely to die. Health and social care workers, everyone over 50 after that, and also those with pre-existing health conditions. So that's going to be the rollout. Now, interesting here, the UK government, or at least the English government, and I'm sure the devolved administrations will do the same, they are simply prioritising those most likely to die and those providing care. This does not seem to be an economic prioritisation. So members of the cabinet and senior people like that will just be vaccinated as their turn comes around, just the same as everyone else. It would cause quite a scandal if that wasn't the case, although quite a few of our senior politicians have already had the disease, therefore I'd expect to be ready to be immune. Although I would still expect them to be vaccinated as comes their turn. Although there'll be more guidance on that shortly. If people have had a confirmed diagnosis, will they still need to be vaccinated? I don't know. Will there be official guidelines on that? If there were, I don't think it would matter, but there will be official guidelines on that. Because lots of people, of course, will be getting vaccinated who had asymptomatic disease, who've had asymptomatic infection, don't know they've had it, but they'll still get vaccinated. So that'll make them even more immune, presumably. Although I do believe they are already immune as a result of their asymptomatic infection. UK-wise, Moderna, 7 million doses by spring. Again, 2 doses per person, so that's only enough for 2.5 million people. Oxford AstraZeneca vaccine, that uses a harmless virus, Okay, that's a bit of a cut and paste mistake, I think. But I think I will mention it now. The Oxford, so basically that's good news for the Pfizer and the Bio N Tech. We're getting some doses of the Moderna. Now, the Oxford AstraZeneca vaccine is also being approved by the UK regulatory authorities at the moment. Now, let's imagine. Oh, and Matt, by the way, a few days ago, Matt Hancock told them to get a chivvy on. He said, "Get on with this." Now, let's imagine that the efficacy of the Oxford AstraZeneca vaccine was the lowest at 60%, and it would still be worth doing. So if it turns out it's only 60%, that's still worth doing. And we know the safety data on it is good. Now, the confusion arose with this because some patients were given an initial shot, an initial vaccination with 25 billion viral particles instead of the full dose of 50 billion viral particles. And they turned out to have 90% immunity if they'd had the lower dose first of all. And this could well make sense actually, because if you give a large dose of the chimpanzee adenovirus initially, then the body will probably develop some immunity to that virus itself. So that could make any future vaccinations slightly less efficacious that you were using the same viral vector. So immunologically, it's not ludicrous that this is the case. Now, there's going to be 30,000 patients are going to be injected with the half dose first and the full dose second, and see if that does substantiate that 90% efficacy. But in a sense, it doesn't alter the practical decision at the moment, because had it been that these vaccines were only 60% efficacious, we would still use them. Anything over 50%. So I do suspect that the Oxford AstraZeneca vaccine will be rolled out. And whether the efficacy of that is 62% or whether it's 90%, we don't really know. We'll learn that with more information as we collect more once this vaccine is instigated. But the key thing is it's passed its safety data. So I do expect the Oxford AstraZeneca vaccine to be approved shortly. I do expect it to be given. And the UK's got 100 million doses of this on order. So this will be readily available to everyone. And the European Union's got hundreds of millions of doses. And in fact, I think the United States have got 100 million doses as well. So I do expect that to be rolled out as well pretty soon. So and I think that's probably why Matt Hancock was being so optimistic about next spring and next summer, because he's got an inkling that the Oxford AstraZeneca vaccine will be rolled out as well. It's a pity the waters have been clouded by this, but there again, it is serendipitous that they discovered pretty well by accident that giving the 25 billion viral particles first and then the 50 billion viral particles as the second injection turned out to be more efficacious. So I do expect that to be approved shortly. Now, I was going to tell you about the books, but I didn't put them somewhere convenient. Just a minute. Right, that video is finished now. Now, I did mention this on a previous video. Now, so that video is finished. Now, what this bit is about is basically I've written these are my books. So there's Campbell's physiology notes there, and there's Campbell's pathophysiology notes there. So this is basically what all basic student nurses and doctors in the world need to know in physiology. Then they would read that to understand how the body goes wrong. Now, I had planned to roll this out to large numbers of people. We did trials on this. I've rolled this out to some African areas already. Only the number of copies I was able to finance were in the hundreds rather than in the thousands, and the same with Cambodia in the UK. But we have done an international comparison on the efficacy of these textbooks between, in fact I could put the link of that in the description, between Africa, well, Kenya it was actually, Kenya, the UK and Cambodian students, and basically it was found to work. So I was trying to roll these books out to all student nurses and medical students in Africa and Asia who wanted a copy. Because when you start to learn nursing or medicine, you need to know basically how the body works. That's that basic stuff. Then you need to know how it goes wrong. That's that one. And that's kind of what I did. And in my style, I use a lot of I use a lot of diagrams, so you know, this book's full of diagrams. There's one of the prostate gland, for example. Probably diagrams of hearts, and there's a nerve fibre. So it's kind of the way I do it. So we wanted to roll this out free to everyone, but I did make efforts to finance this, but it didn't work out. But basically, technology has taken over now. So people in poorer African situations or Asian situations who can't afford textbooks. I've given actually some copies out to students in poorer countries, and they, some of them cry when you give the textbook because they've never had a new textbook before. It's just incredible. But anyway, so we're going to roll this out electronically. That's basically the bottom line. So all these PDFs for these books are now available. They're available free. So any student, nurse or doctor around the world, or pharmacist or physiotherapist, anyone who's interested, can download these, and they can read it off their mobile phone. And the way I write in these books is based on teaching this stuff for 20, 30 years. So 30 years or 27 years I taught this full time for. So I've kind of worked out a way to do it. So the links to do that are available there, and we're hoping it's going to be used extensively by people who can't afford necessarily to buy their own textbooks. And the material here is kind of, it takes you from school into professional life. So, but having said that, any intelligent lay reader should be able to understand that and start making sense of it. It's not highly technical. It's explained bit by bit. And then the way the body goes wrong, that book there is again, that's we're putting lots of diagrams as to how so that one, for example, there shows that fluid can accumulate in the lungs if you have heart disease. We try and explain it in those ways. So do download that free. Now, if you're in a rich country, or plenty of poor people in rich countries, but basically what I'm saying is download these for free. That's fine. If you don't have money to make a donation, please do not make a donation. Do not. This is to be available for everyone, and don't feel you have to pay for it. Having said that, if you can afford to make a donation, we'll accept it, and that will further various projects that I'm working on, so that would be always good. So there you go, I'll put the link, download it. That's your weekend reading sorted out. And of course, the other thing, so I do tend to prattle on about this when I get going. Let's find a kind of an interesting diagram here. There's loads of them. Yeah, there they go. There's a random one on the liver there. So that one's about forming gallstones, common problem gallstones actually. But the idea is with these diagrams is I've drawn them all. They're just drawn by me in black and white. So they're just simple black and white diagrams. So there's the kidney ones there. So the idea is that when you read it and you understand what it is, you can colour it in as well. So it's kind of a colouring book as well. So it just helps, I think, if you interact with the diagram yourself and colour it in, and then you can. So what you can do is you can print out a chapter, have all the PDFs, and then you can go through and colour them in, and yeah, that's it. Don't feel you have to make a donation, but if you do, it helps projects. And I certainly don't want any donations from students who are struggling financially. For you, it's free. You are the whole point that this exists. Okay, so thank you for watching as always. Sorry that bit at the end was a bit long, but there you go, it's done now.